we've been able to show you kind of a newer partnership, a technology partnership. We've also been able to show you how a sporting company and a healthcare technology and sensor company have partnered, and that's more of long-term. And the exciting part about this one is this concept of public and private. You know, when I started in business, I actually felt that there was extreme challenges around the public-private. As a matter of fact, public didn't want anything to do with private. They were like, you know, we're nonprofit, and we don't want anything to do with the for-profit world. And the reality is, and I think the developments are really exciting, is that we're really beginning to see this come together. We did a fantastic session on this last year, and we have even more new developments this year. So I'm really excited to welcome Humetrix and the VA to talk about a complicated way to make things work. You know, the government and private, you know, people, all of us go-getters who are just going to get it done. Some was really funny. So I want to introduce you to our moderator. I'm really excited to have her, Lisa Zamoski. She's a healthcare journalist, author, and speaker. She writes for the Los Angeles Times and WebMD. So this is a great fun fact, especially for me who's expecting right now. The first text message she received just minutes after interviewing President Obama this spring about the Affordable Care Act was a reminder that it was her turn to close the snack shack after her son's Little League game. I'm like, it's, you know, there's nothing like snack duty to bring you back to reality, so thanks.
The snack shack waits for no one. Yeah, absolutely. Good afternoon, everybody. It's nice to be here. As she mentioned, we are here to talk today about the public-private partnership that was established between Humetrix and the VA. I don't think the products need any explanation necessarily. The Humetrix is, you know, creator of the iBlue Button app, which leverages the blue button, allows vets to take their, basically have all of their medical information with them on a mobile application that can be transferred to their physician. And I believe the partnership started in 2012 between the two organizations. And so I guess, well, first of all, let me introduce the folks I'm up here with. Next to me is Peter Levin, and he is the former Chief Technology Officer at the VA and is currently the CEO of Amita Technology Solutions, which, if I'm right, develops patient-centered solutions based on the blue button. Dr. Bettina Experton is the CEO of Humetrix and the creator of the iBlue Button app. And down at the end there, we have Dr. David Douglas, who's the Chief Health Informatics Officer with the VA Medical Center in Portland, Oregon. So I think we'll start by talking about the elephant in the room. There's been a lot, obviously, in the news lately about Veterans Administration and you know, patients dying as a result of long waiting periods. Can you talk a little bit about what's happening in the VA right now, and also in the context of the relationship with Humetrix and the iBlue Button app and how that might play a role?
Sure. I think I'll handle that for you. Yeah. So obviously I can speak openly and freely. There'll be some things that we'll want to be discreet about. Here's the most important thing for you to know about what happened when Secretary Shinseki resigned a couple of weeks ago on that Friday. The following Monday, 500,000 people showed up for their appointments at a VA facility, at a hospital or a clinic, and they received excellent quality services. In my stump speeches when I was in office, I used to make fun of the VA in an affectionate way. I said, look, you know, we all know what a government bureaucrat looks like. We all know that the VA is full of them, people who come at 9:05, take 3-hour lunches, go home at 4, and their job when they're at their desk is to say no or to lie, cheat, and steal. And I met that idiot, right? I know who that person is. But there are, you know, over 300,000 people who work at the VA. And Dr. Douglas here is, for me, the prime example of the seriously dedicated, effective public servant, people who are not fudging their waiting lists, people who are not behaving dishonorably or disreputably. What happened at the VA, I think, is tragic. I don't want to make little or light of people who, in fact, lied about certain elements of their performance metric. There's a lot of things that are being reported, mostly misreported in the newspaper. It's personally very painful for me to watch this from the outside. Secretary Shinseki is a mentor and friend. I think ultimately he probably had to do what he did to take the heat off of the agency and to allow the agency to heal. I think the most important thing for you to know about the VA is that the system works. Does it have problems? Of course it has problems. But when President Obama took office in 2009, veterans weren't getting their education benefits. Disabled veterans weren't getting their claims benefits. Veterans didn't have access to their health records at all, not electronically. So even though the VA had the best electronic health record system in the United States, certainly for its size, a veteran could not get that record for himself. And today, as we start turning a corner, and because of the access problems and because of the congestion that is occurring in certain places, by the way, that's not a ubiquitous issue, but the congestion that's happening in certain places, solutions like what Humetrix has put on the market, the blue button concept, which of course grew out of the VA, is really, from my perspective, the platform upon which we're going to not just solve the problem that is getting a lot of scurrilous media attention at the moment, but a problem that is endemic, not just at the VA, but in our healthcare system.
Can you describe a little bit more about just sort of the genesis of your relationship and where things stand today and how you work together as two organizations?
So this public-private partnership we're talking about had one main reason for being. It was to call on industry and innovative companies to bring solution, to build up on initiatives, policies born out of the federal government, and the VA had a leadership role in that. And one of those critical new initiatives was the Blue Button Initiative, which we talked about, and the VA had a tremendous role in putting this initiative into place inside the VA and also at CMS for Medicare and Department of Defense. So this initiative came about to basically put that critical health information in the hands of patients navigating a complex healthcare system. And even if the VA is the largest healthcare system in the world, somewhat overwhelmed by a flux of new young veterans with severe chronic health issues, mental and physical, that system also interacts with the rest of the US healthcare system. And outfitting patients with that critical health history in their hands through the Blue Button Initiative is absolutely necessary to ensure safe and cost-effective care wherever that patient arrives. So the HHS launched Industry Innovation Competition to build on the Blue Button Initiative so that its initiative will turn into product and solutions such as the solution we developed called iBlue Button, which basically brings that health record from either DoD or the VA, assembles those records on the fly on the individual device so that that veteran, that young veteran has just been discharged from the military and may be delayed in accessing critical care when the need occurs. And nationwide, a study has been done. Over 57,000 veterans are waiting more than 90 days on average to access care. I suspect that if we are studying the US healthcare system in general, we'll have the same type of statistics. But for that veteran now is authorized to receive care outside the VA, paid by the VA, they need to carry their record with them. Otherwise, mishaps will occur, and that's what we do.
Well, can you talk a little bit about, and Dr. Douglas, maybe you can start with this, just a little bit about, obviously a small technology firm and a large federal organization have slightly different cultures. Can you talk a little bit about that partnership and how you bridge that?
So there's some important things that VA brings to this partnership. One of them is a corporate strategy that was championed by Dr. Levin for us to pursue an open source model to modify our infrastructure to take advantage of innovations developed inside and outside the VA. Another one is a very large deployment. We have millions of veterans who are using Blue Button. This isn't just an isolated proof of concept. We actually have tremendous experience with them using it. And that's really important because, I think Blue Button is a terrific idea, but that's not a unanimous opinion across physicians. Okay. You probably remember there was a study last year that showed that 2/3 of doctors didn't think patients should have full access to their electronic medical records. So another thing that VA brings to the partnership is some very good experience that shows those fears about Blue Button, didn't pan out. Not only is it a big satisfier for the patients, it's actually a satisfier for the healthcare team that begins to use it. So all of that, I think, is a wonderful foundation for a partnership with Humetrix and with other companies that are going to work with us in this open source world.
Do you feel like this experience has, in any way, and maybe you can talk about prior to this, what the attitude was like inside the VA in terms of reaching out to outside companies, particularly smaller companies? Can you talk a little bit about the genesis of that?
Yeah, sure. So, as David was saying, there was an enormous amount of resistance inside and outside of the VA when we first put forward the idea that it would be a really good idea to give patients access to their health history. And the secretary at that time had this extraordinary insight from my perspective, as I still think of it. He said, look, so these are people who shoot guns in anger at people who are trying to hurt us. And we trust them to do that well. And they come home and they have some kind of injury or are entitled to ongoing medical care, whether they have a chronic condition or not. And we don't trust them to hold on to their own medical information.
Right.
And so this is, this pregnant pause. And there are some, pretty senior people in that room. And he's kind of looking at them in this sort of stoic way. And he said, well, that just doesn't make any sense to me. Right? And in that moment, the entire conversation changes, right? Mm-hmm. And then you get to start having a conversation about really what, in my view, is, whether you're on the red team or the blue team or no team. The government spends a tremendous amount of money every year. And you want that money to be well spent. Whether you think it's, we're spending too much on national defense or too much on wealth distribution, let's not have that conversation. But everybody in the room certainly would agree every dollar that goes out, we as the public should be getting our money's worth. So what you don't want is for the government to be picking winners, to be saying, oh, it's only Bettina, it's only Humetrix, it's only this one way to do it. What you do want is for us to be a platform for ongoing innovation where forward-leaning people like Humetrix, I'm happy to be a shill for them because they really were such an important and crucial role in the promulgation of Blue Button in its early stages. People who, it wasn't like she was coming to me asking for money. She was coming to me asking for data, which was the data that I wanted to give her. Right? And so all the conversations that we had were, well, what format should it be in, and how should we do this, and who's going to know, and how do we make sure, in fact, that it's fair for everybody? Mm-hmm. So the idea that we can trust patients and the idea of government as a platform upon which we can build innovation on open data generally, but patient data specifically, was really the inflection of the conversation.
Mm-hmm. Bettina, can you talk a little bit about, just from your perspective, from a small company's perspective, what it was like, or any of the challenges that you face that could be instructive for some of the folks listening to this in terms of establishing and maintaining an ongoing relationship with a large federal entity such as the VA?
I can think of
without
one big
putting you
challenge.
on the spot and air your dirty laundry, but just some challenges that.
Love to talk about the opportunity which was presented to us. And
Can you hear her, by the way? No, I don't hear me. Okay.
So maybe I should.
Yes.
So that's better. Yes.
Yes.
So before talking about the challenges, I would like to talk about the extraordinary opportunity which was presented to us when true leaders at the head of those critical health agency, which is Peter Levine at VA, but also it was Todd Park, Chief Technology Officer at HHS, and it was Anish Chopra, Chief Technology Officer at the White House, 3 direct appointees of President Obama, to bring, I think, with a mission to do business in a different way with the federal government. And you all came from the private sector. Peter, you also have an academic background, and you came with that science infused in you. But I think it was clear to you on a mission that you had to call on innovators to realize on your policy. So Blue Button was revolutionary because if we only count on providers to have the information flow between themselves, so that at any time when a patient accesses care, like these young veterans with half a dozen of narcotics and other medications, who has other physical issues, and is now allowed to access care outside the VA, that records need to be in the trusted hand of that individual who can make use of it. And we make that happen in building on your Blue Button initiative and building a mobile app which brings that solution. Maybe I should show a screen. I have one. Here's what we do with Blue Button. So Blue Button is a symbol, which I am wearing big and large on my lapel. And by the way, the government official from HHS is here in the room. Lydia Riccardi is the head of consumer health at HHS. She is the one who has embraced and makes that Blue Button initiative big and large, and bringing the private sector into it, so it can solve problems of millions of Americans. And today, half of the U.S. population has access to a Blue Button, and this word is going to be known. So Blue Button is this symbol, and then we turn Blue Button mobile. And here, what it does for a young veteran, when a active military individual is discharged from the military, they have access to their TRICARE or DoD summary health records. We bring that directly on our mobile device with one tap in a very secure way. But we do the same with the VA records. We do the same in bringing that record in a format they can understand and action it. And then the app in real time aggregate everything on the fly and pull all the med prescribed from the military side to the VA side to outside the VA into a list which is now in the hand of that sick individual accessing an emergency or otherwise care outside VA or military health services. So, tremendous innovation, but built on a tremendous new policy. And I think that's the magic of that and the opportunity of that public-private partnership. Now, about the challenges. Yes, the federal government is not used to deal with small innovative companies, even if you have new leaders at the top who think that they need those to deliver the solutions which are needed. So it takes persistence, perseverance, and conviction to demonstrate that at times it can be a matter of life and death. And so in this time of crisis for the VA, I think this is a prime time for the VA to deploy at scale the solution which is available right now, which can be downloaded from the App Store or Google Play. So no issue of scalability, of infrastructure to develop. It's right there. But it's a path to walk, and the government is used to deal with large contractors who may not deliver the job at the end. We have lived that with health.gov.
But they'll still charge us.
But it will charge you, and a lot, and maybe too much. So, this solution, iBlue Button, is really a mobile aggregator of all those critical records the patients coming out of DoD and accessing VA needs to have. At the same time, DoD needs to build, a bigger infrastructure to have their records stuck to each other for billions of dollars. The technology we have right now is can be downloaded for not much right there on the user device. So that's what we can make a difference, but it's a new way to do business for the federal government.
In light of the crisis that we've been discussing, but also the changing dynamics within the healthcare industry, do you see more opportunity for these types of public-private partnerships? Do you think that there will be more of an openness or a recognition? Like, if you can talk a little bit even about your experience in working with a small private firm like this, as opposed to larger contractors, and how that might have changed the perception internally?
Yes, I completely agree. This is really just the beginning of a very long story of potentially an unlimited number of apps that could be designed that would interface with VA information systems and others in the healthcare industry. And really, the other killer partnership to remember is the one between the doctor and the patient. And so to the extent these apps address real problems, and to the extent the physician or the practitioner actually prescribes the use of them to the patient, then that's the real test of success. And so if I was giving advice or coaching startups, I would urge them to frame their apps with those problems in mind. I mean, it's one thing to have technology that looks great, that a enthusiastic early adopter patient is going to want to embrace. But really, where we want to take this is large scale, and that's by tying the functionality to the problems of chronic disease.
Did you want to say?
Yes, and as a physician, I'm driven by those real problems of real people. And in America, every year, 700,000 accidents occur because of adverse drug interaction. And most of the time, those mishaps occur because at a given time, a physician doesn't have a history of the and the list of the medication who had been prescribed before she's about to prescribe that patient. So outfitting that patient with that list of medication can be a matter of life and death. And so that's what drives me to make things happen, and where those partnerships can make a difference on a very large scale. Again, 1 out of 2 Americans can access a blue button. So those 700,000 accidents every year could be largely diminished. Of them, by the way, 400,000 people die. That's many jumbo jet crashes, but that's an information which is not well known. So it's a matter of life and death. It's also a matter of cost saving. And so 1/3 of healthcare tests and procedures and services provided are redundant or misapplied. Again, outfitting patients with information which gives them some degree of control about the service they are going to receive can be also cost saving.
I'm sorry, go ahead.
I was going to respond to your challenges question.
Yes.
Because I think it allows an insight that you don't often get in how a small company can deal with a large company. Let me tell you about the worst day in my partnership with Humetrix, which is Bettina calling me, I want to say 8:30, 9 in the morning. It's 5 in the morning for her, and she's not happy. And this is very clear right at the beginning. She has a way of conveying this unmistakably. And the problem was that over the weekend, the VA had upgraded the blue button. And what we were doing up until the time that we put it into the CCD format and up until the time that we had made it complete, we had followed this very sort of methodical step-by-step program of, putting the labs in and putting the allergies in. And we were announcing, hey, this stuff is happening. We were announcing it. We were telling everybody that it was going to happen, but we didn't actually tell the small business partner that had never asked for money and that only wanted the data and to make sure that their app didn't break. We never actually told them that we had upgraded the app or upgraded the data. And so this is, I would say, iconic. If you're a small business, if you're a startup, I think we have a room full of people who either are or who will soon be doing things like this. Stuff happens, right? And you can assume that your partner inside the federal government is mean or malicious or is trying to do everything they can to make you fail, or you can assume that he or she is an idiot and forgot to call you over the weekend. Go with door number 2. The second thing I want to say is actually something that David pointed out. And I can't tell you how many conversations, and frankly how many wasted conversations I had, and I'm sure David still has, with young companies, startup companies, and occasionally large companies that should know better, who are just so naive about the government procurement process that they think, oh, you can show up, and you say, well, if you have a good idea, you'll buy it just as if you were selling something to IBM or just as if you were selling something to ZocDoc, right? And the fact of the matter is that as stewards of your money, this is taxpayer money that we're trying to spend, as stewards of your money, it doesn't work like that, right? There's a very, very strict, very transparent, very open process. There are exceptions. I don't want to tell you that it's perfect, but it's actually pretty good. So here would be my strongest possible advice to people who are thinking about doing business with the federal government. Stop asking for money. You're wasting your time, you're wasting your breath, and you're wasting a potentially excellent partner. Here's what you can ask for. You can ask for data. Find the data that you need to make your company successful. If your company lives or dies on getting a federal contract, you're going to have a hard time getting an investor. You're going to have a hard time getting other customers. If your company lives and dies on the data that is made available by the federal government, whether it's the National Weather Service, or whether it's a satellite navigation program, or whether it's personal health information, it's a completely different conversation. And those are conversations that your public servants not only are allowed to have, they're obliged to have.
But I will add from the small company side of the story that we didn't ask for money. We put our fund, our entrepreneurial spirit, and our talents to develop a very innovative and smart solution which can make a difference on a large scale, and which does. And so what I am in discussion with the federal government, not only with VA but also with CMS, is that this is a time to deploy at scale. So we have numerous thousands and thousands of users. who are telling us every day about the positive story and the difference it makes in their lives. When you have patients in federal programs who are dying because they cannot access care and they have now authorized to access care elsewhere, they need to be outfitted with the right technology to get the right care at the right price. And so I think this is a time for federal government to do business in a different way. This is not about going through the typical procurement process with large contractors and or pilot testing for months to come. There are people who are dying out there. There are people who need a solution and be outfitted right now. So we need to do business in a different way, and we are here to respond to that other way of contracting with small companies, and we are working on it.
So do you think this crisis then will sort of move that along a little bit, or to not only for you, but in terms of opening it up to other companies or creating opportunities in a different way? Yeah.
For sure.
That's great. All right, I think that's, does anybody, we have a couple of seconds if there's any questions. One question. Very,
No?
all right. I guess you
Look at a sad face.
answered
Okay.
the question.
Well, thank you very, very much.
Thank you.